Impeccably opposed to this bill.
I call Jan Logie.
Thank you, Mr. Speaker. It's with a degree of anger that I'm rising to speak again against this social security benefit categories and work focus amendment bill that will profoundly negatively impact on our collective well-being. I rise to speak against this bill that will, against best practice, solid evidence and heartfelt pleas, further disempower and exacerbate the significant hardship the most vulnerable people in our society are experiencing. And that is, namely, sole mothers, the sick and the disabled and those caring for them. This bill tells those people that the government knows better than them. This bill tells people with disabilities that they can't assess their own abilities. This bill tells parents on the DPB that they're likely to be such crap parents that the government needs to tell them what's best for their children and threaten them with that sanctions if they don't do what Wellington says, because Wellington knows best how to be a parent. This shouldn't be an ideological battle. And yet somehow this government has managed to, all the way through the submission process and now still in this House, they've managed to reduce all of the evidence from the Ministry of Health, from community organisations on the ground, from the Human Rights Commission, from, that radical organisation called the Legislation Advisory Committee, a subcommittee of the Attorney General's Office. All of that evidence opposing this direction, they've reduced it to an irrelevance. That's an extraordinary feat, I think. In the face of all of the many perspectives telling us that this bill is more likely to create harm than good, somehow this government can still stand in this House and claim so confidently it's for their own good. Well, several people with disabilities have told us, just as one example, that they wanted the name changed from invalid's benefit, which they interpreted as invalid benefit. They wanted that changed. And the government listened. They've changed it to supported living. And yet the feedback from those same communities were, actually, no, that's confusing because that's the name of another funding system, a DHB support service. And yet, in this final version of the bill, we still see that same title. Now, this may seem like a really small point, but to me, it sums up the complete arrogance of this government. This point isn't about money. It isn't even about anything really substantive that I can see. And yet, this government's refused to listen to the people who are most likely to be affected by it. What would it have taken to listen and change the name? Their inability to listen and respond to me is emblematic of a very, very deep problem. Last week I was listening to community advocates in South Auckland who told me how a few years ago they were giving out 35 food parcels a week and now they're handing out 200 a day. That's just one organisation. They told me how, according to Otago University research, a family of 4 in their area should be spending about $200 a week on food to be able to maintain their health. And yet their clients, the average family they were seeing, was only able to spend about $44 a week of their income on food. That's $156 a week short on being able to ensure the health, the basic fundamental health of that family. They told me how private rentals in South Auckland have gone up 16% in just 2 months, and that there's a turnover of about 4 families a year in the private rental housing because the community just can't afford the housing. I've heard about a 7.5-month pregnant woman living in a car because she's $2 a week over the threshold for Housing New Zealand. I've heard about a 15-year-old boy with a disability living on the streets of Auckland, moving around on a skateboard. I know of a woman leaving a violent relationship who's had to tell her children to adapt to having holes in their shoes because she can't afford to replace them. I've heard of a man looking after a son with a disability being asked by Work and Income to sell his car before they'd offer him further financial support. I've heard of people with disabilities with PhDs who are desperate for employment but are unable to get an interview for a job. Our society is showing deep signs of breakdown, and people are starting to lose their resilience. Some people are starting to opt out of the formal economy, giving up on Work and Income, giving up on paid employment because they're just not able to survive. Children are getting sick. We've just seen the report from the Ministry of Health on the rheumatic fever and how the government's health program is missing the fundamental problem of overcrowded, damp housing and poverty. Our children are getting sick. Our children's futures are being stolen from them by this government's refusal to address fundamental poverty. And these stories are not exceptions. Sadly, they are now a norm for the marginalised in this land of plenty. And we've been sold a pack of lies. We've been sold the lie that there's no alternative, or at least that an alternative vision isn't affordable, that the problem is the individual and we need to fix them. We can empower them to get a job. The problem's with them. And maybe that if we reduce the employment rights of workers, well, then maybe more employers will be more likely to employ more people. Well, welcome to the thinking behind the financial crisis. Welcome to the thinking behind growing inequality and social breakdown. I've been listening the minister who to quote her, she was saying that she's heard quite a lot of rhetoric from the opposition about welfare, but quite frankly, she's seen no plan. Well, you know, I wish she'd come to us and asked us for a plan earlier. We could have solved quite a few problems here because, you know, the Green Party does have a plan. And the first step for us would be to consider our values. What kind of society do we want? What do we want for our children and our most vulnerable? And our answer would be that, you know, we believe everyone deserves decent work, a living wage, and to be treated with respect. We believe everyone should have enough income to fully participate in their community, to live safe, healthy lives. We support welfare policies that are sufficient to ensure this, simple to understand and access, and universal in their application. In fact, the antithesis of this piece of legislation, which it is worth noting, has been amended 131 times. There are 54 new sections have been added to this Act since it was first written, and it contains over 50 points of discretion, which, as the Legislation Advisory Committee noted, cuts across guidelines for legislation and Cabinet manual advice. And if the values I've been suggesting tonight seem radical to you, I would remind you that they are at the heart of the UN Declaration of Human Rights. And the very possibility that these values could seem radical to you is truly a sign of how fundamentally fixed this society has become. There's a lot we could do to support the most vulnerable in our society through streamlining our income support service, making it easier to use, reducing costs of running it, of actually helping to create work about solving some of those social problems that are leading a significant number of people to need social support when they may not otherwise have needed to. The Minister has said she wants New Zealanders on a benefit to know that they have a minister and they have a government that are backing them to look beyond a lifetime on welfare. Well, I want New Zealanders to know that the only people in this country who are ever been likely to spend a lifetime on welfare are people with significant impairments. And this bill is going to do nothing to help them earn a living wage and to be able to get off income support.
Sorry to interrupt the honourable member. Her time has expired. I call Melissa Lee.